March is Colorectal Cancer Awareness Month, and Texas Colon and Rectal Specialists want you to know how to detect this and why it is projected to be the second deadliest form of cancer in America for men and women. Dr. Joselin Matthews, colon and rectal surgeon, joins me to raise awareness of the signs and symptoms of colon and rectal cancer and what you can look out for. Good morning. So nice to have you with us.
Good morning. Thank you, Jane.
Really important information. What are the most common signs of colorectal cancer?
So most patients with early colon and rectal cancer or colon polyps do not experience symptoms, and that's the reason it's so important to undergo screening tests at the appropriate age. But if you do develop symptoms of colon and rectal cancer, that can be seeing blood in your stool, having problems with constipation, having skinnier or narrow stools, feeling like your rectum doesn't completely empty when you have a bowel movement, having increasing abdominal pain or abdominal bloating, starting to lose weight without trying to lose weight, and then also experiencing weakness or fatigue, and that comes from anemia from your colon or rectal cancer or polyp, shedding blood in your stool over a period of time.
And as you said, the early stages, you don't necessarily see a lot of symptoms. So that's the reason the screening is so important, right?
That's exactly right.
Okay, so who should be screened for colon and rectal cancer? I hear different ages. What's your recommendation?
So all men and women who are of average risk are recommended to get screened at the age of 45. So the guidelines used to be 50, but now it's 45 because younger patients are getting colon and rectal cancer. If you have a family history of colon cancer or colon polyps, then you need to be screened earlier. Or if you develop any of those symptoms that I talked about, then you need to get screened earlier.
Heredity, what are other risk factors?
So long-term smoking or alcohol use, having type 2 diabetes, obesity or being inactive, and then also having inflammatory bowel conditions as well.
Okay, so what are the current colon and rectal screenings that are available, and how often do you recommend people get them?
So there are multiple tests that can be done to screen for colon and rectal cancer. The most comprehensive one is a colonoscopy, and that's where you're sedated and we put a camera inside of your colon and directly visualize the colon, and we can remove a polyp at the same time. If you can't undergo a colonoscopy, then you can do stool studies that look for blood in your stool or stool DNA, and those are done every 1 to 3 years. And then you can also do radiology tests like a virtual colonoscopy that's done with a CT scan or a barium enema. You still have to do bowel preps for those, and then if any of those come back positive, then you still need a colonoscopy.
And you know what? I'm going to tell you here, the last time I had a colonoscopy, the prep, the procedure itself, there have been so many advances that it's not that big a deal. It's really not. It used to be, but it's not anymore. How can viewers learn more about all this?
We have a website, tcrscolondoctors.com. It has plenty of resources on it talking about preventative measures and diagnosis and treatment options as well.
Thank you so much. Important information. For more information, visit tcrscolondoctors.com or follow them on Facebook at Texas Oncology.